right, guys, welcome back to another episode of the Fill Me In Pod. I am Injector Jon.
And I'm aesthetic nurse Nicole.
And we're just going to give a little life update with this.
We're going to have a fun one today. Yes.
A little fun one today. We're going to touch base on a bunch of things, but it's the end of summer and everybody's getting ready for back to school.
That's right. Everyone's getting their last minute vacations in.
Yeah.
I feel like we're going through that, like, you know, people call the same day and they're like, oh, I can't come in today.
Yep. I know right now up here in New York, we have the New York State Fair that just started.
Okay.
And it's for 2 straight weeks.
Oh, man.
So I don't know, like everybody the next 2 weeks are getting ready for school.
And going to the fair.
They're going to the fair. They're doing all these things. And plus they're like enjoying their last 2 weeks of freedom before school starts.
Yeah.
Yeah.
Are you going to the fair?
Like one day. I'm not a huge fair goer.
What do we get at the fair? Is there food?
Oh yeah. I mean, I would get like the funnel cake. I would get probably they have these fresh donuts that are there.
Yum.
These peach donuts, which I might not sound good to people, but they're good to me.
I love peach. Sign me up. Maybe I'll come up there. We'll go together.
Yes, we should. But yeah, it's fun.
So you just got back from Aesthetic Extender, right?
Yeah, missed you.
I know. Stop. I had so much FOMO.
Still on maternity leave. She's coming back. Well, you're back this week.
I'm back this week. Starting Tuesday, I'm back in the office. I started training again this week. But they have this conference every year at the same time as my family vacation every year.
Which will have to be moved next year, just by a week.
The family vacation is getting pushed back a week next year. So I will be there.
Yeah. Great. Oh my God. But no, it was fun. It was a lot of fun. All of our injector besties were there, you know, Erica, Faye, you know, it was just a great time.
Olivia was there. I saw
Miss Olivia.
Oh my God.
Erica and Olivia pretty much owned the stage. They were on there.
I love that.
Basically, there wouldn't have been a conference if it was for them.
Yep.
But it was a great conference. I've been to a few. I haven't been to like all of them, obviously, but I think what I like the best about this conference is that there were more live demos. And I think as providers, we're very hands-on people. Yep. So for me, I got the most, out of this conference, I think just from seeing other providers inject. And of course, a lot of them had to be on label, but there were some off label injections too, for certain lectures, but it was really good.
Which I think is huge. I was actually just talking to Faye about this because I was throwing a conference around with her and we were saying how sometimes you go to them and it kind of feels very repetitive and you're getting the same information. So like seeing live injections, I feel like is awesome because it gives you like almost techniques that you wouldn't get to see from like a PowerPoint, you know? Yeah. And then the off label I feel like is so important too, because I feel like we get to hear so much on-label stuff. Yeah. We see it all the time, obviously, because there's reasons for that. But when you have that off-label education, it just makes you feel like you're getting so much more.
Yeah. Yeah. I mean, it's cool. I mean, I feel like, if you're a brand new injector, these conferences are everything. Like, I mean, they go over all of the pearls that you need to know. And, but even as a more experienced injector, if you're, 10, 15 years into it, 6 years into it, 8, whatever, it's good for networking. It's good for your social media content. You're going to learn something new at these conferences. If you're a business owner, they're great because they have the huge exhibition hall, which they have like, Cyton, and they have Essence there. They have every skincare line there. They have all of them. So you can like meet with them, maybe open an account. You can find out which things you like, which things you don't.
So like you can even sometimes get like treated.
You can actually get a treatment and like test it out and see if you like it. So it's cool. That's really nice.
We've talked about this on a prior episode too, but like in the past when I first started injecting, like I never went to anything and it was just because it wasn't an opportunity for me. And as I continued to grow and started going to these things, I was like, oh my God, like you get so inspired for one, seeing everybody else and like seeing what everyone else is doing. You come home with so many ideas. It's funny. Melissa just went to a course the other day and like just throughout the day, she texts me like these small little things. Like it's like 2 words, but it's like, so she remembers to tell me about it later. Like, cause you just catch so many little like pearls that you wouldn't have gotten if you didn't go. So I just feel like they are so, and let alone the networking. I mean, how many people have we met because me and you met because we went to a train the trainer event. Like you meet people because you put yourself out there and you learn and it's a great environment for kind of a community.
Well, and that's the one thing I think I'll say about, and maybe like every profession, right? I think if you want to be I think the best or want
Mhm.
to try to be the best in the area that you are working in, I think you have to network. You have to
Absolutely.
put yourself out there a little bit because if you don't and you just stay in your bubble and isolate yourself, you're just going to
Mhm.
be, closed minded. You
Yep.
have to be very open minded, in
Absolutely,
order to be
absolutely.
good.
And that kind of goes back to what we always say too, like community over competition. Like if you're
Yep.
always looking at other people and like trying to figure out how you can be better than them or do it better than them, like you're never going to be building yourself. Like you need to just figure out what works for you, what works for your patients and build that way and use people around you as inspiration and community.
Yeah.
And
100%.
that's what these events do. I'm so
Yeah.
mad I missed it.
Oh my god. And then of course, so we on this podcast, we've been can we say partnered with Join
Yeah.
Moxie? Like, we've been doing an ad for them and which has been so fun. But Join Moxie was actually at Aesthetic Extender and
Mhm.
um one of the managers or one of the directors or something of Join Moxie reached out to a bunch of us asking us to be a part of this like shopping experience at Neiman Marcus, which was really cool. They picked us, me and like I think like 15 to 20 injectors up in a limo,
I love it.
and there was Veuve Clicquot in the limo, and there was music. We got there, and they gave us a gift card to shop, and it was just fun to like almost just celebrate like all the hard work that we've done,
Mhm.
over the year and things like that. Because these conferences, I mean, we leave our loved ones to go to these to
Right.
continue our education and all of that, and to do this, and it just helps to network and meet other
Absolutely.
people.
And it's good to have fun.
And it's good to have fun and
You
let loose a
gotta,
little
yeah,
bit.
exactly. You gotta let loose
Yeah.
because it's so true. Like I mean, we work a lot and
Yeah.
it's a lot and you don't realize until all of a sudden it's like all piled up.
Yeah.
So it's nice too because the conferences are a good mix of like serious and education, but then
Yes.
also fun and play and seeing everybody and letting
People
loose.
don't get it. Like going to these, like I'm also having dinner meetings with people. You know what I mean? It's not just, I mean, yes, we're able to have dinner with our injector friends and maybe meet for a drink or a cocktail or
Mhm.
whatever, but it's a lot of like networking and doing meetings and things like that.
Yeah,
Hmm.
and I feel like too, there's always some form of lectures on like injecting and then business as
Yep.
well. And even social media. Like
Hmm.
it's funny because I just feel like we do so much social media. Like I don't really feel the need to look look for that, but that
Yeah.
is at a lot of conferences. And the business side too, like even if you're not a business owner, like I feel like you can learn a lot from,
Yeah.
numbers and just kind of know like, oh, okay, this is the ballpark and what I should be in, especially new injectors. I feel like a question we get all the time is like,
Hmm.
what should I be making? Like you could find those answers at these conferences.
Yeah.
And I think it's important to remember too as a new injector, like you have to be bringing in a decent amount in order to make a decent amount. You forget overhead and all of
Yeah.
this, and the fillers and Botox cost a lot of money and
Yep.
front desk and bills and
Overhead.
all that. Exactly, there's a ton of overhead, but so like I
Bills
feel like
are
there's just a lot of
the amount of bills, are you kidding? I mean, it's never ending.
never ending.
I don't think I've never gone a day
Nope.
without paying a bill.
Yep.
There was
Yep.
one day I remember I go, "Wow, I didn't pay something." And then all of a
Yeah.
sudden I looked at my email and there was an invoice from like
Yep.
my accountant or a
You're like, oh,
lawyer
never
and I'm
mind.
like, "Oh, okay,
Yeah,
great."
I've also never had a 0 credit card balance since
Oh,
since opening a
zero.
business.
Always credit increase because you have to like just get the Amex people. Just get the
Yeah,
Amex.
just get it. They put a spending limit on mine, okay?
Oh God. Oh, we got to talk to them. No, 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 no. It's so
That's
funny.
that's how much that thing was getting swiped.
Oh my God. It's so true. It's everything is so expensive. And I think as a business owner too, you want to like create the best experience for your patients
Mhm.
and you don't want to cut corners. So it's like,
Absolutely, yep.
yeah, sometimes I'm like, yeah, just
Just
get it
do it, yep.
because you want to give that experience to people and that
100%, yep.
high luxury feel.
Mhm.
Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
But no, conferences, what would you say, Nicole, makes a good conference to you? Like, what do you look
Definitely.
for?
Okay, so topics. So conferences will always put agendas out. And I think the main thing I look at is topics and who's speaking on the topic, because I think you want to make sure basically that the information is evidence based and you're not just getting like a,
Mhm.
biased or like sponsored answer, you know?
Yeah.
Like
Yeah.
sponsored luncheons and stuff. Every conference is going to have that, but you want to make sure that the speakers, you know, may not be sponsored, evidence-based. And I also don't like when they're too long.
Yeah.
I do like shorter with
Right.
more information so you can see more and hear more.
Yep.
I don't know. What about you?
No, I think you hit the nail on the head. I think it's the topics. I really like a variety. If it's just
Yes.
injectables, it's a little boring.
That's a good point. Yeah,
I like
absolutely.
to, now that we're getting into biohacking and longevity, I think that's what I loved about AmSpa, I will say. Like I said, they had like both ends of the spectrum,
Yeah.
you know, which was great because we're now kind of uh, focusing aesthetic medicine on not just the outside but the inside of the body too.
Absolutely.
Right, like, you know, whether it's supplements and things like that. So I love that. I think the other thing is live demos. I think if it's just all
True.
lectures, it gets a little dry. Like, I just don't want
Absolutely.
to sit there and, you know, I need like some actions, you know, and just to have some hands-on opportunities. Right, like that's
Absolutely.
okay.
Absolutely. And I feel like, what was it
Oh,
that I
I
went
mean,
to?
I do
Yeah.
like a good themed party. I'm not
Oh,
gonna lie,
a
when they put those
100%.
on.
Yep.
I mean, let's be real. I mean, you're there from like what, 8:30 in the morning, 8 in the
Yeah.
morning with these lectures all day,
You
and
want to
then
just go and get changed and
you
have
do
fun.
and have fun.
Absolutely.
Yeah.
Absolutely. No, I totally agree. And for it to be warm. That
Yeah.
is one thing too.
Yes, and I will say most places, most of the conferences we go to, it's warm.
Yeah.
Thank
Yep.
God.
Yep.
Yeah, they choose a warm
I
location
think that's why a lot of the times they are in like Florida or
out
Miami.
west. Yeah.
Yep. Or yeah, exactly. Yep.
Yep.
California.
Yeah.
Because no
Yeah.
one wants to go to a party and have to wear a coat.
Yeah. The other thing too, which I like Allergan put on actually it was a free cadaver
Oh, wow. Oh, that's
aesthetic
amazing.
extender. You literally, it's got sold out with, I think, within like 20 minutes.
Wow. Yep.
But so anyone who decides to go to aesthetic extender next year, make sure that you work for someone who has an Allergan account, and then you can go on. I think it starts at like 11 a.m. or something, and you have like, you go on and sign up right away because it's free.
Okay. So
And
it
I
sells
think,
out.
and I know that I got an email at the end of the conference, and I collected 15 CME credits.
Oh, that's incredible.
So it's great.
That's incredible.
Yeah.
Yeah. That's actually one great point. Another great point is CME credits. So like having
Yeah.
continuing education credits. So it's like one thing to attend these and spend money to attend these and take time away from your practice and family to attend them. But when you get something back for doing that, that helps you with keeping your license and, you know, everything up to date. I think that's huge. So getting some form of CEU or CME credit, I
Yes.
think
Yep.
is a major component too.
And even like when we went to Modern Beauty Con, I mean, we did that cadaver there too.
Yep.
And I think we also got CME for that,
and
didn't we?
that's Dr. Sirk's like injection anatomy.
Yeah.
So yeah, you get a good amount actually with his as well.
Yeah, which is
Yep.
great.
Yeah.
Something new too that I just announced on my Instagram is that I've just been asked to be a RESN's PDGF trainer,
So exciting.
which is awesome.
Yep.
This drug is absolutely, I mean, it's revolutionary. I think it's taking the aesthetic world by storm, causing a lot of controversy, you know, which is crazy, I think, a little bit.
Well, I think it's honestly, I think it's crazy that this is causing controversy, yet people are injecting exosomes and that has never been an issue with anyone.
Mean,
like it's been an issue with some people and obviously people have made videos on it, but it was nothing like the uproar that this has caused.
Well, and I think my biggest pet peeve is people saying, you know, be careful, it's illegal to inject Ariessence PDGF. Well, we're not injecting Ariessence PDGF, we're injecting PDGF BB. It's pure PDGF BB, which has been around for 15 to 20 years. You know, it has
and is used for injection. So this is an off-label use of that injection.
PDGF BB has an indication for injection in the body.
Yes.
Just not the face. So we're using it off-label in the face.
Right.
And we're having wonderful results.
Yes. Same thing like before Voluma got indicated for the temples. Voluma we would use in the cheeks and the jawline.
Right.
And we were using it off-label in the temples. So it's very similar in that aspect.
Yeah, I really don't. I just don't like how people spread so much hate about it though. Like on, you know, it's like if you hate it that much or you have a problem with it, then don't do it. don't use it.
Right.
You know,
Yep.
let people that want to do it. You know, it is what it is. And I don't know.
Yeah.
You'll be sad. I think you're going to miss out.
Right. And two, like looking into the research, you know, it's one thing to watch people on social media and be like, oh, I don't think you should be doing that. Like, okay, show me some articles or some reasons as to why you think so. Like, I'm always open for a good, you know, educated debate. Like, and also you might be able to tell me something I don't know. So give me reasons. Don't just hate.
Well, I really loved Wasim Garbia's post on Instagram. And we can have Joey put it up here. But there's been over 1,500 studies conducted and reviewed with PDGF BB.
Yeah.
That's more than Botox Cosmetic.
Right.
Botox has over 600 studies. So, you know, it's just, it doesn't make sense to me.
Yeah. The research is there.
The research is there and the results are there. Are you kidding me?
Right.
All my patients who get, you know, PDGF are obsessed, whether it's topically with the HA, which is the RE-Essence PDGF. I mean, someone just came today for their third microneedling. They're like, I'm freaking obsessed. I could do this every month.
I know.
And
I mean, I never would go without makeup. I have no makeup on right now.
I know. And you are literally glowing.
Thank you.
And when did you do
my
it?
under eyes. So my under eyes, I think we're going on 4 weeks now. So I'm just starting to kind of really notice the brightening and the effects there. But microneedling was like 6 or 8 weeks ago now. So I feel like it's like really...
Yeah, you're glowing
at its peak. Thank you.
You have like glass skin. Like it's great.
I'm obsessed. I'm absolutely obsessed. Yeah.
Yeah.
You're like, yeah, I told you.
No, not even. I'm just like looking at your skin and it's glowing.
Jon told me for like 8 months to start using PDGF, and I'm like, I'm still looking into it.
I know. Well, hey, you're doing your research. You're sitting back, whatever.
Yes,
I know.
Yep.
I remember literally, it was a little over a year ago. I remember seeing one of the old Allergan reps that had left and then joined RE-Essence, and he was there at Modern BeautyCon, remember? And he had the booth for RE-Essence, and no one was really around it. They're like, what is that? And
no one really knew what it was.
He was telling me it was this, you know, FDA, the most potent FDA approved growth factor for topical use, blah, blah, blah. And I'm like, oh. And I was like, okay, maybe I'll consider it. I took his brochure. Yeah. And then literally like 4 months later, I'm seeing like Wasim and Eric are using it. And I'm like, Olivia,
I gotta look into this.
Wait, I gotta look into it. I'm like, send me samples. And then I was using it and I'm like, okay, this is really great.
Well, and you know what? Liv, I feel like she's always like 10 steps ahead. Like she talked to us about that Our Self skincare, which I carry now too. Like, do you carry that one?
I do.
Yeah, we both carry it now. Like, but she knows about everything like months before. She's so in it, and she like does her research, and so I just gotta text her every month, be like, okay, what's new?
I know. Yeah, I know. And now she's in Australia launching Daxxify, which is incredible.
So cool.
Yeah, which I will say, and I know people that are listening in or tuning in that follow me, people know that I brought on Daxxify at my office, and I tried, you know, everybody's entitled to bring on to whatever neurotoxin to their office, but I carried Botox and Dysport for years. I was like, I really need a third. So I tried a few, and Daxi really worked well for me, Corey, Alicia, like all of us. So I was like, let's bring it on.
Yep. We carry it now too, as well. And I feel like, you know, in the past, like we've had Xeomin, we've tried like all these other ones, and they just, in my opinion, were no different or no better than Botox or Dysport. So I was like, why do I have a third option? You know, what's the point? But Daxi kind of stands apart in that, where, you know, you get,
and it's peptide based too, which is really cool. Yeah. And I mean, you do get a Botox glow. I'm sorry. Like anytime I get Botox, I get a glow as well with Daxi. I mean, it's peptide based. I mean, I'm sure you see the glow right now.
Oh yeah.
It's
glass skin,
a beautiful neurotoxin that works pretty well.
Yep. And it is cool to see like all the new stuff that we're seeing and getting, and we're going to always be evolving. So
always
got to stay on the trends.
I know.
Safely.
I know.
Do your research.
I just had dinner with our MSL, medical sales liaison.
Medical science liaison, yes.
Or science, science liaison. And so she's like...
yesterday I was talking to somebody and I meant to say chiropractor and I said dermatologist, so I get you. Brain's broken.
Oh, no. Are they all PhDs?
I don't know.
The medical science liaison? Okay.
I'm not sure. I think they have to be.
Right?
Yeah.
And her name's Camille. She's like, she's great. She's so smart. But I know that there's some things coming along the pipeline, like skin bead for the neck, and which will be good. I've done a few patients with that. I think that's going to be a tricky one.
Mm-hmm.
I think training and depth
It's
of
going to be
injection is going
important
to be really important.
because the skin is so different there.
It is.
Yeah.
Yeah.
But that's exciting.
We were talking about a couple other things too,
Yeah.
which is good. Well, it's a good opportunity because you can ask your medical
Right.
science liaison all the off-label stuff. So I was,
Mm-hmm.
talking to her about PDGF and mixing it with Skin Vive and mixing it with whatever. And she's like, oh, she's like, you're mixing it with Skin Vive. I'm like, yeah, I did it to my face. I'm obsessed. Like,
Yeah.
she goes, well, what happened? Did you have any reaction? I go, well, yeah, I had a histamine reaction.
Yeah.
I had the whole inflammatory cascade. I had bumps under my skin, but they went away within 2 to 3 weeks. Like, it's fine. But she said, you know, she's like, I think PDGF is a great product. She's like, I don't know about mixing it with an HA. And I'm like, okay. Like, she would just be worried about too much,
reaction,
cross reaction or whatever, which I understand.
Yeah.
But for me, I was very willing to do it to myself.
Yeah, and that's what we have to do. If we're going to do it to a patient, we got to make sure we try it first.
I mean, and I've done it on patients, and they've had really good outcomes. I mean, you just have to really tell them the post-care and what to expect, anticipatory guidance, all those things. But I don't know. I'm always trying things.
And the MSLs are great too. They can always send you studies and things of that nature. Also, years ago, I had a patient call me having one-sided weakness after Botox, and she was concerned that it was related to the Botox.
Mm-hmm.
It turned out she was in a car accident 3 days prior and had injured her neck, and it was just all the perfect timing. It wasn't the Botox. But so I called the MSL and we had a nice long discussion, and she sent me some studies, and we kind of were could it be this, could it be that, and then we obviously got to the bottom of it. But they are there to help you. If you ever do have a case, when patients call me with stuff like that too, by the way, I'm never oh my God, I've heard weirder things. Things can happen, So try to help them,
100%.
So I was like, let me call the MSL, let me call my rep, let's try to figure this out. And
yes,
they're very, very helpful. Yeah, very helpful.
I know.
That's also why I love a company like Allergan, because of the fact that they are so large, and I know they do get a little bit of a bad rap because of that, but the help is there when you need it, and that's so important. So important.
Yeah, no, I totally know. I know. I think the biggest thing is that there's been such a shift with filler, and I feel there's been a lot of people scared to get filler, but I also feel a lot more people want regenerative, biostimulatory things, right? I think that it's really important to understand that aesthetics is evolving. It's always evolving, which is a good thing, right? We want to evolve. We don't want to remain stagnant. Filler will always be filler. Biostimulators will always be, biostimulators. I think there's a place for both of them,
right?
There always has been. But I do think personally that with the surgence of skin health and lasers and, CO2 lasers, Moxie, BBL, all of those things. I think that there's been more people spending money on skin treatments, which in turn, people are doing that to promote collagen production, to reverse sun damage, right? Then they're thinking, oh, collagen production, we lose collagen. We want to, we want anti-aging. So then they get Sculptra or they get hyperdilated radius, and they're spending less money on filler. But what we have to understand is that we still lose bone in
volume.
We lose volume. We lose our superficial, our deep fat pads. We lose bone, especially in the anterior medial part of the cheek first, which is what elongates the lid cheek junction. There's a lot of different things that happen. So we still need filler.
Right.
So I think that there's been a pendulum happening, but I think, things are gonna, even out.
Yeah. And I do, I find it funny. This is just a thought. I think patients for some reason think these things like Sculptra and hyperdilate radius and even PDGF, for some reason they're just not as scared by it. But it's not reversible. These things are creating collagen, and they're creating new tissue for you, which is great. But if you do run into an issue or you build too much, there's no reversing it. So in my head, filler is a little less scary for that, because I could, if I really need to, use ultrasound and get in there and really find it and dissolve it. I don't know, but I just find it funny, because I feel patients find it less scary, when in reality it's okay, well that one that one you can't really get rid of.
Do you know what I thought was interesting? After my the MSL dinner, or medical science liaison dinner, I was talking to her about Sculptra and how, I do it, into the hairline,
Mhm.
whatever, just to keep things tacked back and, promote that collagen production. She was like, just make sure you don't go too superficial with it and the hairline because you could have hair loss.
Interesting.
And I'm like, what? And I said, really? She's like, oh yeah, if you're too superficial,
Is
which
it
if
like
you're,
blocks the follicle?
yeah, oh yeah. Yeah, it'll affect the
Wow. Yep.
circulation with the
Mhm.
follicles, and then
Yep.
you'll have hair loss. So, like,
Yep.
obviously, like if you're injecting it in the appropriate depth for
Plain. Yeah.
Sculptra,
Yeah.
plain, you're
Right.
fine.
Right. But
But
see, this is why conferences and dinners and
yeah,
talking with people is so important because you learn something new every day.
I know. I didn't know that.
Yep.
I was like, but it makes
Makes
sense.
sense.
And also
Absolutely.
think about it, filler too. If you're too
Yep.
superficial with filler, it
You're
could
going to block.
affect.
It's almost blocking. Yeah.
Yeah,
And it kind
it's
of
not just
flow to that follicle. Yeah.
yeah,
That's
yeah,
crazy. Yeah.
yeah.
Yep.
hmm And I feel like hair growth, like hair health, has gotten
Hmm.
so
Popular too.
popular, don't you
Yep.
think?
Oh,
Are you
yeah.
guys doing
Absolutely.
PRP for hair in your office?
So we don't do a ton of PRP for hair, like here and there. But with PDGF, now we're getting a lot of people
Yeah.
getting it done because the PDGF before and afters with the
Yeah.
hair is incredible.
Yeah. I had one session of PDGF in my forehead,
Hmm.
and I loved it. I need to do my second round of it, but I
Yeah.
need to do it like right through the center part where it's starting to concave a
That's
little.
so funny. Do you see right here?
Oh, a little bit. Oh yeah,
Because I have a vein that runs like right this way. So when I laugh and stuff, it really pops out. But I think it's just created like a little divot in my
a
skull.
little valley. Yeah.
Yeah. Yep.
Maybe put a little
So
PDGF in there
exactly.
without
I'm gonna
nicking
hit it up.
that artery.
Yeah. Yeah. That is the most important part.
Then you'll end up with a bruise for like a month.
Yeah, that'd be me especially.
Oh my God. Us fair skinned people, I
It's
tell
so
you.
not fair.
Oh my
Well,
God.
before we started filming, John had asked me how my PDGF was doing, and I was like, "Good." Honestly, I was so bruised that like
Yeah.
I feel like when I was
Yeah.
finally not bruised, I was like, "Wow, I'm so bright."
Yeah. Oh my God.
But people are actually commenting on my under eyes, like on Instagram and stuff. And you know me, I don't use any filters,
hmm
and like you can see right now, I'm not wearing any makeup. Like it really made a difference.
Oh, it's impressive, isn't
Yeah,
it?
it's a real game changer,
Yeah.
honestly.
I mean, I don't know. We've reiterated this before, but I mean,
Hmm.
it's increasing your collagens 1, 3, and 6 by 400 to 600%, and your hyaluronic acid concentration by 800%. So
Yeah, it's just like it's insane.
science, man.
I want to run. We'll see if we leave this in here. If we do, it'll be a bonus for everyone. I want to
Okay.
run a patient by you. So, like, I had this patient years ago, probably like 2 or 3 years ago. We did mid cheek and under eye,
Okay.
and she is probably like a darker Fitzpatrick, like 4, 5.
Okay. Is she
Um,
Hispanic or Vietnamese or
I'm not entirely sure, but more. She's not African American,
okay?
so
Like
she's not. Yeah,
Dominican? No, Guatemalan.
I don't know. But either
Okay.
way, darker skin tone. I do the filler, everything's fine. She ends up having like sinus issues and stuff down the line. And then one of the times that she got sick, it caused the filler to react. So like the whole area, like really swole up. And she didn't think even twice about it until she saw a dermatologist for like a different reason. And then they brought it up and she was like, oh, it's probably your filler. So then she contacted me. And back then we kind of were still just like dissolving instead of treating. So I had gone
Yeah.
straight in. I had gone straight in with dissolving basically. When now I'm kind of like, oh, I really kind of wish I did steroid and antibiotics first just to see how she would have healed. Either way, the swelling had come down by the time I saw her. Obviously, I would not have dissolved her if she was still having a reaction, but
Mhm.
swelling came down. The swelling had caused, I think, so much like trauma to the tissue that she actually had discoloration at that point.
Oh.
So she actually was in today and saw someone else at the office, and I had them send me pictures, and it has taken several months, but we've gotten the discoloration gone. So like we've treated it, and I thought, have you heard of like darker tissue when you use a cannula becoming hyperpigmented?
Yes.
So I feel like maybe the filler, but then it wasn't there before she was swelling. So like this tissue swelled up and then it went down and then the discoloration was there.
Was the discoloration darker or lighter?
Darker.
Darker.
Yeah.
So,
And then I dissolved. So she is pretty hollow. So the whole point of this long story, is do you think
No.
I can do PDGF on her
100%.
and use a cannula and you think it'd be fine?
I think it would be 100% fine.
Yeah.
Yeah, and I would do a cannula,
Mhm.
probably not needle because it might
Right, because
cause a
I don't
little bit
wanna
more
right,
trauma,
yeah, I don't wanna
but
cause any more to that
you
tissue.
might, inadvertently help
Right,
her discoloration
right.
because what I've noticed is that the appearance of melasma and like post-inflammatory erythema or um, hyperpigment is
Mhm.
improved after
Interesting.
using PDGF
Okay,
because it basically pushes you into that reparative phase quicker. Like,
okay.
you know what I'm saying? So, like,
Yes.
think about it. When you apply topical PDGF on top of microneedling or an ablative laser, you're in
There's
that
not as much.
inflammatory
Yes,
phase.
yep.
So, it's basically speeding that inflammatory phase up to prevent any post inflammatory hyperpigmentation
Mhm,
and move you into that reparative phase, which is more of that collagen production, angiogenesis, like, all of that tissue repair and healing.
mhm.
So, I mean, I think it could possibly help
Yeah,
her.
I'm gonna because I was just like in my head. I told her because it was like a few months before I was even pregnant, I think, and then I was like checking up with her while I was pregnant. And I was like, when I
Yeah.
get back from maternity leave, we're gonna see where you're at because us as practitioners, we understand how long hyperpigmentation takes. Some patients may not realize that, but it takes months if you have true hyperpigmentation, and the only thing you can do is like topicals and time,
Yeah.
sometimes laser and stuff. But so I gave it like a good, I would say 8 to 9 months at this point. So I want to try to see if that PDGF will be
Yeah.
something that's good for her.
Yeah. I think it definitely could be.
Yeah, yeah. And I did the even incorrect serum and the even incorrect spot treatment. I think that really helped
I
too.
almost wonder though if you were to do because I've seen my melasma patients,
Hmm.
their melasma improving after receiving topical PDGF
So maybe start with
or
topical.
Area Essence, like doing microneedling with Area
Okay.
Essence PDGF. Like if you know what I mean, and really
Yeah.
focusing it under the eye to see if it will help to decrease inflammation and decrease that melasma
Yeah.
or that pigmentation. Um,
Yeah. Because at this point, the pigmentation is pretty much gone. It's now the hollow.
it's not the
Yeah.
hollow. So yeah, just
Yeah.
do PDGF. You'd be good.
Yeah.
Yeah,
Yeah.
PDGF BB. Hmm.
Yes. Yes. Thank you for clarifying.
Yes. Hmm.
Sorry, long-winded story, but I wanted to get your thoughts on that, and then I felt
Yeah.
like other people could benefit from hearing it. So,
But a side note with that though, I really
hmm.
have, and I mean, I can just say, so as a on-label PDGF trainer, I can say that the appearance of, their skin has improved
Hmm.
with PDGF, like their pore size has gone down, their fine lines and wrinkles have improved, their texture obviously has improved. But what I've really noticed with my patients who have melasma, especially if they're having baby or hormonal issues or just
Hmm.
whatever, they're more prone to it, is that after getting microneedling with RES and PDGF, their melasma is so much better.
Yeah,
And it almost looks like they had a chemical peel.
it's crazy.
So love it,
It makes sense though, the way you
right?
explained it. Yeah, absolutely,
Yeah.
absolutely.
Another thing I wanted to talk about too is that I feel like injectors that are listening in, if you guys are newer, you guys went through summertime. I feel like a lot of
Hmm.
newer injectors that are building their books, this is a slower time for a lot of
Yes, don't
people.
get discouraged.
Don't get discouraged. It's we were all slow in the beginning when we
Yeah.
first started, and obviously now we're blessed not to be, but
Hmm.
it's normal. And
Yep.
take honestly use the downtime to work on your social media content, to
Oh,
refine your
that's a
skills,
yep. I
and mhm.
being home, I started posting way more, and it's not even like injectable content. It's literally just like life, and I've gained like over 1,000 followers in a month.
Yeah,
Like if I feel like if you just get to a point where you're consistent and you're posting and doing that,
yeah,
you'll get growth. And Rana, we could put her Instagram in here. She said something on her Instagram recently, how like if you're just authentic and you're you, it's never gonna feel like work doing your Instagram. And I'm like,
it's
oh my
true.
God, it's so true. Like, why are we all like, let me throw some makeup on and let me talk this way and let me sit
No,
this
just be
way and do that?
you.
Like, just be you. Like, if your hair's in a messy bun and you don't have makeup on, you just rolled out of bed, like
Yeah.
still hop on there because guess what? One, you're relatable, and two, it's gonna make you do
Yep.
it.
Yep.
If you have to wait till you have a full face of makeup on, it's never happening.
Oh my God. We want to see those dark circles, honey. Come on,
We want to relate to you.
Yeah. Oh, I love Rana. She's the
I know
best.
she really is. Oh my
Hmm.
God. And she's just so funny.
Yep.
So what conferences will we be attending this year, huh?
Well, I will say, I really want to do AMWC Americas, which is in Miami, Florida. That's February 15th through the 17th. It focuses on anti-aging techniques, strategies, innovations to expand knowledge and connections.
I would say if you're a newer injector, AmSpa is great because there's just so much to see and do. And the exhibit hall at that is pretty extensive.
Right. I'm definitely going to do the aesthetic extender next year.
Yeah, that I will be doing for sure with you.
I would love to do iSpan.
I've heard really good things about iSpan as well. That's soon though, right?
Yep, September 24th through the 28th. Well, is it? Yeah, 2025.
Yeah,
it's this year.
Mm-hmm. Where is that one? Does it say?
Yeah, it's in Fort Lauderdale.
Fort Lauderdale. Yeah, so Florida. Everything's always in Florida, guys. Get ready to fly if you don't live there.
The other one I want to go to though is the Med Spa Pro.
I haven't heard that one.
Conference. Yeah. Erica's going. It's a good one. Leslie Fletcher, I think, is going. I think.
Okay.
Very very research evidence based.
Okay. Where is that one? Do you know?
I don't.
Well, send me that. I'll go with you.
Okay. I'm not going to go obviously this year, but I will next year. There's just too much going on this year.
Yeah. Yeah. Do you want to give everyone an update? You broke land.
Oh, yes. Yep. So our practice, we finally broke ground and it's being built, which is really exciting for our practice.
So exciting.
We should hopefully be in, they say June or July of 2026, so next summer, but I'm hoping for like September of next year realistically, but very exciting.
So exciting.
Yeah.
And then once
so much that goes into it.
Up and going, maybe we'll have a training room. We'll start offering.
Yeah. Oh, and the other thing I wanted to announce too is that I am forming my Patreon.
Oh, snaps for you. I already have a Patreon, but don't follow yet because
oh my God, you cracked me up.
I don't post enough for you to waste money on me.
And finally, I have gotten the urge. I'm doing it. I think I brought it up to you like 2 months ago that I was going to do it. And then I didn't do it.
That's a great idea. You know what? If I'm going to do it with you, we'll do this. We'll be this venture together.
Yeah, because it's so much easier because the amount of, DMs that we get
for trainings
and also just for simple questions, and we want to be there for everybody.
Right.
It's just our personality. And we hope that our podcast has been a really good resource for a lot of you guys. But with Patreon, you can actually see us hands-on doing treatments or just talking or seeing our lectures or doing whatever.
Yeah, so, absolutely.
Or we can just send you the link of your answer of your questions
for the video.
Patreon.
Yep. That'll be our, let's see, by 2026 goal.
Oh yeah. 100%.
We'll have our Patreons ready to go, loaded with content for you guys.
100%. It will happen. Yeah, because truthfully, like we got to do that.
Oh yeah,
we have to.
It is, and it's silly. Like we're filming our stuff anyway. Like why are we not editing those videos and uploading them?
Yeah, and we have a lot of really exciting things, Nicole. Right, things coming over the next few years, especially now that we have that training room at my office, and I'm sure we could use your office for some things. But me, you, and possibly a couple other people. So
yes, some celebrity guests.
Yes, it'll be fun.
Be very fun.
Yeah. But
well, thanks for listening, guys.
Yes. Thanks for tuning in to another episode of the Filmian Pod. We love you guys.
Yes. Love you.
Till next time.
Bye.
Bye.